quick legal disclaimer, all information in this podcast is the opinion of the speakers and not meant to be a substitute for a diagnosis and consultation of a qualified healthcare provider. All right, everyone, welcome. Thank you so much for joining me for episode number 2 of Jaw Talk with Dr. Tiffany. I'm so excited today to welcome my first guest, who is just been such an instrumental person in my life to help me get started with my business. So I might start crying. I want to introduce you to Kim Seamers and tell us a little bit about yourself and how we met.
Sure. Well, first of all, thank you for having me. Second of all, if you cry, it's okay. We're amongst friends.
That's right.
Well, lucky for me, I found you is more like it. And you have been instrumental in my life as well, which you know, we've talked about it at length. So again, my name is Kim Seamers. I am a patient and a friend of Dr. Tiffany. And what was it, 3 years ago now? I had been just living with chronic pain, chronic facial pain that, very specifically I thought was related to ear, nose, and throat issues. And I kept going to an ear, nose, and throat specialist, and he kept doing T-scans and finding nothing. And, he floated the idea of facial migraines and things like that. Mm-hmm. And he couldn't get to the root of the problem. And eventually at one point, he kind of had an aha moment, and he turned to me and said, "Does your jaw ever hurt?" And I mean, at that point, it clicked harder than my jaw, And I said, yeah, like all the time it pops. Sometimes it'll lock up on me, and I just have been dealing with it. Mm-hmm. In addition to, chronic ear pain, chronic sinus pain, headaches, neck aches, constant tension. And he goes, I don't think that this is, by the way, just so we're clear, this is after like a dozen or more visits with this ENT trying to nail down exactly what's wrong with me. Mm-hmm. I don't think this is an ear, nose, and throat issue that you have. I truly think this is TMJ. Mm-hmm. And that's what he told me. Mm-hmm. And he gave me a referral to Dr. Tiffany Lamberton. And I met with you about a month later in Tacoma. Mm-hmm. First of all, just so we're clear, it was very hard to get on her books, just in case you're wondering. She's a busy woman. It literally, they said, "She's a month out, is that okay?" And I thought to myself, if I don't take this appointment, I'm never going to get to the bottom of this. So I was like, absolutely, whatever it takes, like, please just get me on her calendar. And that's when, we started talking about the orthodontia I'd had in adulthood, because when I was little, I had a diastema that I hated. For people who don't know what that is, it's gappage in your teeth, but primarily a gap between your two front teeth. Mm-hmm. And my mother thought that this was a cosmetic thing, so she didn't do anything about it. Mm-hmm. But kids are mean, and I grew up with this issue, with this huge gap between my two front teeth, and I hated it. I got teased relentlessly. And so in adulthood, I saw an orthodontist, and there was no conversation about any consequences. There was only conversation about the benefits that braces would give to me. But moreover, this was a male orthodontist, and he kept saying things like, think of how beautiful you're going to look. Think of how pretty your smile is finally going to be. Think about how proud you're going to be in all of your pictures.
And can I just interject here? Was there any type of imaging done at that time with the orthodontist, do you recall? Or
yeah, there was. I mean, they did a 360.
The CT scan.
Yeah.
CT.
But, he did that and said, your palate's fully formed, but I can move these teeth, no problem. Like, made it seem like this was, just standard procedure. And I'm a product of the 90s. All of my friends, all of my cousins, even my sister had braces. Thanks, Mom, for that, by the way. Just another favoritism dig. Yeah, Jenny got everything. I'm just kidding.
And did your jaw hurt at all prior to the orthodontic treatment?
A little. I do have degenerative disc disease in my back. So there was a little popping, but nothing like after I'd had the braces off for maybe 2 years. And as you know, I have those fixed retainers, but they were gapped for a reason. And the reason was that my tongue is bigger than how my teeth are closed now. So I tongue thrust all day, and if it weren't for my fixed retainers, my gap would reopen. It actually does reopen every single day a little bit as far as the fixed retainer will let it. And then at night when I put on my Invisalign, it closes back up. And I tongue thrust, I catch myself clinching all day. And this is all because because the doctor said, you'll be so pretty. And my childhood insecurities were like, oh, finally, I'm finally going to have the smile that I want. He's right, I should do it. And everyone else did it, but everyone else did it when they were 11 and 12, when their palates weren't in place. I was 26.
Right.
So, yeah. I think that was an instrumental, or sort of the catalyst for my TMD disorder. Like that was what catapulted me into this sort of chronic pain and with no escape until I met you.
And now, one of the things that you and I had talked about when we first did your assessment and your kind of comprehensive exam was I told you how passionate I felt about having MRI imaging of the TM joints. And I feel like that's a barrier to a lot of people. So tell me a little bit about what was it like when you experienced that?
Sure. So a little private information I don't mind sharing is that I suffer from chronic anxiety. So I too am not a fan of being told that I need to be stuck in an enclosed space
Tube, yeah.
for,
30 minutes.
Exactly. And you're going to be positioned frequently by an imaging specialist specifically to get angled photos, angled shots of your jaw. But the first thing I would say is you sent me to the right imaging center because they do specific for jaw.
Yep.
They're very, very focused.
Precise. Yeah.
Yes. And I felt like they made it as comfortable as something like that can be.
Could be.
It was a drive from where we live. It's north quite a ways, but it was totally worth it. I felt so comfortable. They made sure, they came in often. Do you need a blanket? And it was probably half hour, maybe 40 minutes of them repositioning, making sure, do you need music? It's kind of loud, we know. But that 30 to 40 minutes of doing this extensive MRI work allowed you to finally give me a diagnosis and treatment options for something I had literally been living with for 6 years. Just chronic tension and pain.
Right.
And I finally had an answer. And so to endure the 30 to 40 minutes of being uncomfortable in an MRI, to finally know what is really going on with you is, I would do it 7 times if you told me I needed to, So we finally have our answer.
Yeah.
Which is what, Doc? I'm really messed up, y'all.
Well, and what I remind people as well is I try to make that comparison to other orthopedic joints in the body. If you had a meniscus tear in your knee or you twisted your ankle going down the stairs, I think that really wanting to understand the whole picture of what an MRI can afford you. And that way you can make that decision of whether you want to do physical therapy and maybe a brace or you wanted to have arthroscopic surgery. And I feel like, unfortunately, a lot of dentists in my experience really shy away from wanting to even order an MRI. And I've had a bad review, like, Dr. Lamberton, I don't know why you're ordering an MRI. Why are you doing this? You're just an example of kind of the excess of the system. But my philosophy is that if you kind of own your own anatomy from the beginning, then we can talk about that, those treatment options. And then it just really creates this, I think, assurance of like, okay, now I'm going to make this decision for me and for my own anatomy And I think that's really the key part, because it does change the discussion of the prognosis, and it really gives us an idea of whether your joints are stable or are they actively breaking down, you know. So
Right.
same thing like with your knee. If you knew had degenerative joint disease of your knee and you knew that you had no cushion and it was just bone on bone, you would want to know that
Right.
prior to deciding, am I going to try to live with this for a while and do some of these, you know, maybe more conservative treatment options, or am I going to elect to have surgery, or can I put surgery off? And so I think individually it is really important to have that understanding and that discussion from the
Yeah.
very beginning.
I completely agree. It helped me make an educated decision and like own my own, you know, diagnosis.
Right.
Once you had the opportunity to review that, you know, you called me.
Yeah.
You said, "We need to talk. We need you. Can you come see me? We gotta. This is. We gotta. You gotta come down." But even prior to getting my MRI, you gave me actionable suggestions of treatments I could do on my own when I was not with you.
Mm-hmm.
And they were so the exercises that you gave me were so simple,
Mm-hmm.
but they were so effective. And it was crazy. It was like night and day in
Mm-hmm.
some respects. And it really did help relieve so much for me, just knowing that, okay, I have an advocate finally.
Mm-hmm.
And when you ordered that MRI for me, it wasn't like, this is excessive. It was almost this moment of, there's finally
Like
someone,
clarity.
yeah,
Yeah.
clarity. There's finally someone who's listening.
Mm-hmm.
There's finally somebody who wants to get to the bottom of this, not just, you know, well, we're just not finding anything, so it must, you know, taking a leave, I guess. You
Right.
know, go roll the dice at Walgreens on over-the-counter painkiller.
Right. Well, and I also see myself as kind of this bridge between providers, because I think that we get so, as healthcare providers, we get so siloed and kind of like, okay, I do this. Like a dentist, they're like, okay, I'm focused on the teeth. An orthodontist, they're like, I'm moving teeth. I'm changing the bite. You know, an ENT, they're like, okay, well, I'm taking out tonsils and adenoids, or, you know,
Right.
and really, I think more and more as dentistry has started to pivot more to understanding how airway is important to what we do and how we're uniquely positioned to be that person, to be evaluating that. So we have to be that advocate for our clients and our patients, and we have to be that one that is really working together to build that collaborative team of, you know, maybe a sleep physician, maybe an ENT, maybe a chiro, maybe, you know, physical therapist, and then really be sort of that leader that is communicating and saying, like, this is what we see, this is what we've decided, and, you know, really advocate for you
Yeah.
as the client. So, which really kind of leads me to the other little question that I asked you is, how do you feel about patriarchy in our healthcare system?
Yeah, wow.
It's kind of a loaded question.
It's not for me because I have an immediate answer. I feel like I get talked over. I feel like I get dismissed. And I feel like I'm not the only one, you know, and this is a little off topic if you don't mind, but I had
Yeah.
a male primary doctor for a long time. And every time I went to see him, he would say, you know, you need to lose weight, you need to lose weight, you need to lose weight. And I kept saying, I'm down to like 1,000 calories a day and I go to the gym 4 times a week. Like essentially at this point, I don't know what you want from me. I'm starving myself and it won't come off. So I finally got a female provider. She's at ARNP, you know, a nurse practitioner. And she said, did he ever test you for thyroid, like hypothyroidism? And I said, I don't even know what that is. You know, how would
Right.
I know to advocate for myself in that way?
Right.
And so she tested, and sure enough, I have hypothyroidism. So I'm out here starving myself, killing myself at the gym, doing everything that I can. And this whole time, I could, you know, it just was, he just thought I was a woman who was hysteric in eating.
That word, hysterical.
Hysterical.
Yes, yes. And I think that with TMJ, TMD, that word gets just like attributed to that as well. I think with migraines, I think that with a lot of, we're starting to understand more about complex regional pain syndrome, where our sympathetic nervous system is really involved in that back loop. And I think that patients with jaw joint issues have been told they were crazy for years, and it's all in your head. Yeah, it is in my head. It's my jaw.
Yeah, you're right about that.
But yeah, I have just been thinking more and more about how women in particular feel dismissed. They feel like you said, talked over, or not, that they weren't listened to. And I really want for us to be like thinking forward, like how can we do better, and
Right.
what can we do to really sort of tear down some of those walls and change the system. So I think it's really interesting to see how, I think in general, people really want to feel better. With the
Yeah.
pandemic, we were all kind of stuck at home. We were hunched over our laptops and kind of like these makeshift, in the corner,
Yes.
trying to and I'm like, oh, my neck hurts, like, oh, yeah, I'm like clenching my jaw, or, and so I think that there's this really like renewed passion with the pandemic of like, what are solutions that I can do to feel better?
Right.
Whether it's like your sleep, better sleep, or, kind of like helping with your musculoskeletal injuries, helping with your overall wellness and well-being.
Investing, I think we talked about this once, investing in products that you truly believe might provide some kind of support, relief. There are products you've provided me with. I know very specifically you fitted me for a night guard. I wear it every single night. And I told you I recently went on a trip and I left it. And the first night was miserable, miserable. I took probably 6 ibuprofen the next day, 200 milligram ibuprofen. Not recommended, by the way. That's not a doctor endorsement.
We have a
I'm not
legal
physician.
disclaimer already.
Yeah, okay, good. Sorry, paralegal kicked in.
Yes, I love it.
But no, I could tell immediately the difference. I mean, I just woke up in so much pain. I could tell that I had been clenching and grinding my teeth all night, but I'm 5 hours from home. There's nothing I can do. I even went to like a Walgreens trying to look for the cheapest.
An over-the-counter one?
Yes,
Yeah.
anything to apparently just bite down on in my sleep.
Sure.
But I think that all of us are sort of thinking about that now. The quality of life is now more important because we've had that time to reflect and, I mean, honestly, be trapped in our environments. And so apparently mattress sales are up quite a bit because people
Good to know.
Yeah, they now care about their sleep.
Totally.
People are buying more ergonomic things for desk jobs and things like that.
Yes.
But I think especially for this, there's been a couple, devices that you've had that you thought would help me. And I'm absolutely willing to pull the trigger on any of that. Like anything that makes your life more comfortable.
Right.
It's too short.
Absolutely.
We're here for such a little amount of time in
Right.
the grand scheme of things. You have to be comfortable.
Right.
And
100%.
yeah, and I think that's a good lesson that we've taken away from this pandemic, and that's another reason to find the healthcare professionals who are going to advocate for you as
Absolutely.
opposed to people who are going to steamroll you and tell you you're hysterical.
Right.
Just so we're clear, I'm not hysterical. Do I seem like a hysterical woman
No.
to you?
And I didn't really prep you for this, so if you don't feel like answering it, it's fine. But I would love to hear what's next for you.
What was the personal attack?
Yes.
No, I'm just
And if you don't want to answer it, we can just cut this part
No,
out.
it's fine. I'm currently getting my undergraduate degree in creative writing. I've been a paralegal for the last 15 years. Well, I've worked as a legal assistant and moved up as a paralegal with on-the-job training by attorneys here in our home state. But yeah, I'm working on a creative writing degree. I was in business administration, but you can only do so much in Excel before you start hating statistics. Can I just say?
I
Like,
already hate
yeah.
statistics.
And I've always really I've written a couple op-eds I've never sent in because of course I have like imposter syndrome. You know, if you don't have a degree, you feel like, what, you know, I can't, what am I doing here? This, no one's going to want to read my,
Excuse me, I will be happy to read any of the copy that you write.
well, thank
I,
you.
I
But
mean, even your
yeah,
emails are fantastically composed.
I try. I really have a fondness for language, and I
Mm-hmm.
think it's somewhat fundamental in our house. We read a lot, and there's a lot of writing with our son. We do a lot of homework with him, and he's only 6 and he's in kindergarten, but he just placed in like second grade
Wow.
English and second grade
Of
math.
course. Go, mom.
Well, I honestly, it's kind of annoying because when they're smarter than they're supposed to be for their age, you can't get out in front of it in time.
Yeah.
Like, he literally called me cringe the other day, and I was like, "You're
Oh, I get
6."
called cringe all the
Yeah,
time by
but
my 10-year-old.
yeah, what is that? I'm
I'm
sorry.
like, you know what? I'm 49 years old. I think I'm doing okay.
Yeah.
You know?
I know. I had him when I was 30, so he introduces me as, this is my mom. She's exactly 30 years older than me, and I'm 6. That's what he says.
That's awesome.
I took him to the barber shop yesterday,
Oh,
and
nice.
the first thing was he asked the cosmetologist how old she was.
Did she answer?
She did.
Yeah.
And then I explained to him how some people might get offended by that question.
Right.
So he proceeded to tell her how old I was immediately after I explained why that wasn't it wasn't
I
a
love
good
it.
idea.
I love
But
it.
yeah. He is great with language. I think language is important. He does go to a bilingual school where they teach Spanish and English. But at home we speak primarily English and some French because I am French Canadian.
Yes.
So I think it's kind of hard for him, but it's all Latin based.
Right.
He's fine. He'll figure it out.
Ooh, tell us about your Winnipeg roots.
Oh my goodness.
Just a brief
Yeah.
little.
Well, my dad came down to Washington State on a holiday. He was working in British Columbia, and my mom grew up in Eastern Washington in Spokane.
Good
You
old
know it
Spokane.
well.
Yes, I
Yes, yes,
do.
you do. And he saw my mom, and I think American Woman was a pretty popular song at the time, and he was like, I'm going to marry that woman. So my French Canadian father, who was just randomly working in British Columbia, met an American woman, and they got married. They had my sister first, and she was always the favorite.
Right?
Yeah, no, she really clearly was the breadwinner from jump with the grades that she would bring home. Breadwinner in the sense that she like brought home the good grades and stuff.
Right.
They put me through this class called Where There's a Will, There's an A
Oh,
because I got so bored.
that's
I was like,
amazing.
I literally apparently once told my teacher, and I don't remember this, but I apparently said I can do it, I just don't want to.
Yeah.
Yeah. But so, no, my dad's family lives in Winnipeg, some of them, and that's where we lived with him during the summers, which were very warm and lovely. I mean, honestly, the summers there are beautiful. People always think of snow because it's the Midwest. I never had to endure that. I mean, the summers are in the 90s. My aunt had an in-ground pool. She watched us during the day when my dad went to work. So what more could you want? You
Right.
know, we're living the life.
Yeah.
But my dad is actually from a very small mining town in northern Manitoba called Flin Flon.
Nice.
That's the real name of a town. That's a place. And they have erected a 60-foot statue of a fictional character, Flintabadity Floniton.
Okay.
That's true too. That's a real thing. And he was the explorer that headed out west and found the town.
Nice.
So, no, it's not. It's weird. My grandparents are both from the Quebec area, and they both were very French. They did not teach their children French. My hypothesis is so that they could fight in front of them. But yes, they all grew up in this very small mining town, and you know, most of my cousins have stayed working in the mine. But yeah, it was pretty interesting. I lived here during the school year, northeast Tacoma, and I lived in Winnipeg during the summer with my dad.
I love it.
And when you come home and you sound like this, but you also have a giant gap in your teeth and you're kind of chubby, it doesn't make for good first days of school, eh? No, it was terrible. It was terrible. I mean, just think of gap-toothed, right? Kind of chubby because I have a slow metabolism, just naturally. And then I sound like this. People would say, can you say about? Can you say the word about?
About.
Yeah. And my sister was able to get rid of it, but I couldn't. My American grandmother always said, you have Manitoba on your tongue.
Yes.
Get that Manitoba off your tongue.
Well, my mom was born in Saskatchewan. She was like 11
Really?
of 15 kids.
No, really?
Yep.
Oh my goodness.
Yeah.
Whereabouts? Was it near Saskatoon? Or
Yes.
Was it, yeah.
It was.
That's great.
And then the family ended up moving to Kelowna, BC, and
Right.
then all of the cousins and like, yeah, everybody is all up there still.
Yeah. No, seriously, British Columbia is beautiful,
It
but the
is.
relocation to Kelowna is interesting. So is that how your parents met then? Did she come down on holiday?
They ended up meeting in college, so she went down to Walla Walla, Washington for college, and she met my dad there. They were both on the gymnastic team.
Oh, I love that so much. That is the
So-
best meet cute ever.
Right.
There, you've got a Canadian and an American, and they're brought together by, gymnastics.
Right.
Are you going
Right.
to do Olympic tryouts? No, I'm going to marry you, girl.
That's right. That's right.
I love that.
Well, tell us a little bit about your podcast, or like where can people find all of your funny?
Well, you probably don't want to. It's not.
Oh, okay. All
It's
right.
not. I think we have a very small listenership. So
You don't want to promote it.
no, I can for sure. It's called. I do it with my cousin. Her name's Jessica. It's called Useless Conversations with Kimmy and Jess, and we talk about nothing, which is my favorite thing to do. From talking about my jaw disorder. This
I love that you want to talk
seconded.
about your jaw disorder.
Yeah,
so-
seconded. Useless conversations seconded to my
Perfect.
jaw disorder. No, it's called Useless Conversations with Kimmy and Jess. We talk about nothing. I think our listenership is mostly our cousins and some close family friends. I don't think
You haven't broached out into the wider world.
No, not really.
Well, your TikToks are amazing.
Oh,
Even my 10-year-old watched them.
they're not. They're just. It's something. It was something fun to do, especially during the pandemic. I had more up, but they didn't get as many views, and you start to feel insecure about stuff. So
Oh,
you take,
don't feel
you know,
insecure about
yeah.
that. Yeah.
I don't anymore because I don't care.
Yeah.
Anymore. I used to care a lot about what people think, and as you get older, you start to realize like,
Yeah.
no one's thinking about you anyway.
No, they've
You're-
already moved on.
They've moved on. Not only have they moved on, but like they're only thinking about themselves just like you're only thinking about yourself. They're
Totally.
concerned that they're doing something wrong just like you are. you
Right.
know?
Right.
So, no, people can pick us up anywhere. You can pick up a podcast. Spotify we go through Anchor, which is a subsidiary of Spotify.
Okay.
That's where we record and edit our our podcast right in the app. You can do all of it. It's not as fancy as this. We use our basic technology, and we're not that great at it. But yeah, we just have conversations that are pointless.
I love it.
It's fun. It's very fun. We try to keep anything controversial
Sure.
out so that we can, just appeal to everyone and everyone can feel like they have a good time listening. But yeah, it's conversations about nothing. I had with this one episode where we talked about sloths because I love sloths. I think that their life is so dope. Like,
Yeah.
if reincarnation is real, I'm just putting it into the universe. It's like the secret, you have to speak what you want.
That's your spirit
If
animal.
if reincarnation is real, I want to come back as a
as
sloth.
a sloth. Nice.
Their life seems so cool. They do nothing, and it's
Nice.
napping is one of my favorite pastimes.
Oh, absolutely.
Yeah. So apparently, I didn't know this. Could be a fun fact. The only reason we have avocados today is because of sloths.
Oh,
They were the only ones who were like able to digest the pit. So because they kept eating them, they kept growing. And had they not done that, we wouldn't have avocados. So
That's a
we wouldn't,
fun-filled fact.
yeah, we wouldn't be able to spend $2 on an avocado that we put on toast or let go bad on the counter.
Right.
Yeah.
Nice.
Thanks, sloths.
Yeah. All right. Well, what would you like to see from like TMD Collective as like a community? What ways could we grow and really
Yeah.
like garner support?
I think the best thing I can hope for TMD Collective is that we do grow, that you grow, and that
I
people
like that you said we.
we it's
I keep telling Kim that the universe is telling me that we're supposed to work together.
we are just that I think that what you do is so important, and it's an area that's just so overlooked.
Yeah.
It's something that without the referral to you and seeing you probably would have gone undiagnosed for me for years, or would have maybe possibly been misdiagnosed.
Mm-hmm.
You know, like I said, the ear, nose, and throat specialist I was talking to, he was kind of convinced I had these facial migraines.
Mm-hmm.
And he really wanted me to go see a neurologist.
Mm-hmm.
And I kept saying to him, you know, I don't, my sinuses are only a part of this. This is bigger.
Mm-hmm.
And that's finally when I think it hit him. But yeah, I hope that more people get to you, they find you, that your reach is big enough that you can start helping more people, because the change that you've made just in my life alone has been, I mean, I can't even explain it.
Aw.
Chronic pain, to be in chronic pain always, and to finally have somebody say like, no, your problem's valid.
Mm-hmm.
You don't just have a headache because you're a crazy woman.
Right.
You know?
Right.
Are you stressed? Maybe you should smile more. Drink some water. Did you try that? No, I
Love it.
didn't.
Love it.
You know, but yeah, I really hope that for you and for TMD Collective, that you just grow, that you continue to expand. And my biggest goal personally is that we can take a trip to Florida so you can be with me when I do get my
Totally.
jaw surgery.
Totally.
Because the one thing we haven't discussed is my MRI results, and they were not good. They were
Well,
terrible.
I don't want to do like a HIPAA violation. So.
That's okay. You're not, so you didn't say anything. Yeah, it was not great. And so I really am excited to, you know, work with you and with a good surgeon and figure this out permanently. But
Mhm.
right now I see you about every 6 months, and
Mhm.
and you take care of me and make sure that I'm doing my exercises. Sometimes I have to see you more frequently than 6 months when I'm not doing my exercises. If I'm being honest, it's more like every 3 months.
Mhm.
But you really help me, and the pain gets alleviated. I mean, like, we just had an appointment, like 2 weeks ago maybe,
Mhm.
and I'm already feeling so much better. Like, it's amazing. It's and I can tell when I haven't seen you and it's time to make an appointment. I can
Mhm.
tell. Like,
Mhm.
it's what you provide to people, not just the advocacy that, and the promise that you're going to be there to listen and to provide the care, but just the knowledge that you have, I think,
Right.
is something that not a lot of people put stock in, and you really have committed yourself to this cause in a way
Mhm.
that is going to be so fundamental for anyone that you help.
Oh, thank you.
Well, it's true. I'm not.
Thank you.
You asked me to come here and talk to, this is just things that are true.
Thank you.
I know, because it's what you did for me.
Thank
Without
you.
you, I don't know where I would be. Probably just miserable.
Well, and like I said, my mission is to really like change, kind of like the mindset in my whole profession, and not just dentistry, but other specialties that treat MJ and TMD, because I think that when we form this network of, providers that really can think about things in a different way, I think it
Yeah.
can be a huge impact, and like you said, a kind of bringing that empathy protocol, where you're listening and not just rushing out the door in 5 minutes. So
I
I
think it
think,
would be instrumental to so many people's lives. There's people out there who are suffering from this who don't even know what it is.
yeah,
And I know because I was one of them. I was one of them for like 6 years after my braces came off.
Yeah.
And it wasn't until I found you that I even knew what was happening, you
Yeah.
know?
Yeah.
And I tried everything. I mean, not just the ear, nose, and throat doctor that referred me. I tried chiropractic.
Mm-hmm.
I tried, I'm like doing Pilates and yoga, trying to meditate my pain away.
Yeah.
Obviously taking all those over the counters, doing
Yeah.
and taking so much decongestant because I thought it was sinus
Mm-hmm.
related when really it's just me clenching all day,
Right.
causing this nerve pain,
Right.
And without you, how would I, honestly, like Dr. Tiffany, I have no idea what I would do.
Oh, thank you so much.
It's true. It's just true. Blanket statement. It's true.
Yeah.
I have not been paid to be here. She did make me coffee though. So,
Well, thank you so much for sharing your story. That just means the world to me. And like I said, if you'd like to learn more, TMD Collective is built to guide, educate, and create community for individuals experiencing jaw joint problems or TMJ, TMD. And like I said, stay tuned. We're going to be doing great things.